Good afternoon, everybody, and welcome to another edition of our informational health series, our virtual health series for families. My name is Zara Arboleda with Valley Children's Healthcare, joined by two exceptional members of our clinical teams who are here to talk about mental health during what is May and Mental Health Awareness Month. We've got Dr. Carmela Sosa and Amy Hardcastle with us. And so why don't we start with some quick introductions here, starting with Dr. Sosa, who is our Medical Director of Primary Care and also our Medical Director for our Guild Center for Community Health. Dr. Sosa, thanks for joining us today.
Oh, my pleasure to be here. I'm actually a Fresno native, so taking care of the kids of this valley are really near and dear to my heart. I have been with Valley Children's now for a little bit over 10 years and with a special interest in kids with medical complexity as well as mental health. And probably, when it comes to this, one of my really important credentials is also that I am a mom of 4. So have some of that real world experience too, in really dealing with mental health issues.
Thank you, Dr. Sosa. And we have licensed clinical social worker Amy Hardcastle here, also with Valley Children's, also works with our wonderful school districts in the area. Amy, why don't you tell everybody here who's watching a little bit about yourself as well and why this is so important to you.
Oh, thank you so much. So I've been with Valley Children's Hospital as a per diem social worker since I think 2003. But my primary job is I'm a clinical social worker with Fresno Unified, and I've been with Fresno Unified, for about 15 years. And so I think, and as Dr. Sosa mentioned, my probably most important role is as a parent of teenagers. So I've gone through all the developmental stages as a mom and as a care provider of my children and now working with teenagers. So I'm living it and breathing it, as many as you all are as well. So I can speak from a professional background as well as a personal background about how we talk about mental health and deal with mental health in the community as an individual. I think why it's so important to me is just the stigma around it. We all have physical health, we all have mental health, but for some reason, when we use the term mental health, it just is, it's received in a different way. So I'm happy to be a part of this and having this conversation, so we can maybe eliminate some of the stigma around that and have some open conversations and support families with that as well.
I love it. Thanks to both of you. And it is something that we have been trying to destigmatize for a long time, especially since 2020 and the world shut down and the pandemic uncovered so many gaps in behavioral and mental health services and the need for people to be willing to talk about it. So for those of you who are watching right now on Facebook, feel free to leave comments or questions in the comment section and we'll get to your questions. You can also send us direct messages on Instagram or on Facebook as well. And if we can't answer your questions during this time, we will get answers to you later. And also a quick reminder too, if you go to Valley Children's website, valleychildrens.org/360me, that is our own special section on mental health services that has lots of resources for you. But we've been soliciting questions from the public for the last week or so. And so let's just have a conversation now and answer some of those questions. And one of the first ones, and Amy, we were talking about this before we started, and Dr. Sosa knows this too. We get a lot of the same types of questions, which shows that so many families are struggling with the same issues. And one of the number one questions moms and dads, one of the number one questions they have is, what are signs I should watch out for in my child that might indicate my kid is struggling with their mental health, might be overly stressed, might be anxious? So why don't we start with that? And I'll leave it to both of you. Again, it's whoever wants to take this one first, just go for it.
I can jump in there, Dr. Sosa. However, I have a really strong feeling that you're going to have some comments about this as well. There's so many things to look for. I think the number one response I would have is just look for significant changes. They used to be involved in activities, now they're not. They used to be quiet, now they're aggressive. They're sleeping too much, they're sleeping too little, they're eating too much, they're eating too little. Like, all of these significant changes can really be a red flag. Changes in grades suddenly, not wanting to attend school, complaining of tummy aches or headaches, things like that. Any type of self-harm behavior that maybe you haven't noticed before. So that was kind of a long list. Do you have anything to add, Dr. Sosa?
No, there definitely is a long list. And it's really, like Amy said, a change from their baseline: eating more, eating less, sleeping more, sleeping less, more aggressive, more passive, less aggressive, less passive. And also more social media use can sometimes be an indication. In addition, kids who have body image issues with body image, they may wear large clothes really to conceal that they're trying to lose weight, or if they're self-harming, if they're cutting or injuring themselves, burning themselves, they may wear long sleeves when it's 100 degrees outside, really just trying to hide and kind of shrink back into something else. And so just looking out for really any of those changes.
Dr. Sosa, something I've heard you and the other complex care pediatricians at Valley Children's always say is, no one knows a child better than their mom and dad. And you always say degrees aside, clinical education aside, sometimes it's just a parent having a feeling that something is off. But how do you distinguish between, I've got two kids, one is just turned 14, the other one is about to be 13. How do you distinguish between changes in behavior and just sullen teenager? Like it's so hard sometimes to tell what could be depression or what could just be puberty. I don't know.
Yeah, we all have bad days. We all have days where we're not feeling as well. And so you might notice a slump one day or another, a couple of days in a row, especially if there's been something stressful happening. But when it's been prolonged, when it's been greater than 2 weeks, definitely is when you want to start thinking that there may be something going on. Amy, I don't know if you want to add something in there.
I couldn't have said it better. I think, like you said, and I think even normalizing that when we have those conversations with our children is, we all have sad days. We all get angry. It's just kind of how we respond to it is and how long we're responding to it, if it's a positive way or negative way, and if the coping skill is a positive coping skill or a negative coping skill that prolongs some of those symptoms. Again, just having those conversations with our children can have a huge impact, but totally agree with everything Dr. Sosa said.
So Amy, that then begs the next question. How do you even start talking to your kids about this? That is another common theme when it came to the questions being submitted to us by folks at home, was how do we even start the conversation? And I'm assuming a conversation with a 5 or 7-year-old is going to be much different maybe from an upper grade kid in high school or even a 6th or a 7th grade. Oh, you muted. I can't wait till we're all in person again. I got to tell you that. But yeah, there you go, Amy. Yeah, how do you start it?
I think what you said about developmental level is right on. If I'm talking to a little guy, if my kiddos, maybe preschool, toddler, kindergarten, I might watch the movie Inside Out with them, and have conversations about, gosh, when do you feel sad? When sadness talks about this, and really, what happens when I think the character is sadness or anger, or the different characters, or bring in a storybook that elicits. There's so many books on SEL right now. So you can start with a story, even your own story. You can start with a storybook or a movie, something that's relatable to them. But if you just use the example of sad, mommy gets sad sometimes when I stub my toe, or if my dinner doesn't turn out the way, and just, again, normalizing it and giving an example so that they can relate, can also give examples. Maybe a kiddo who's a little bit older, again, you can still have a conversation maybe around sadness. When I was your age in middle school, it was kind of hard for me. It made me sad when kids left me out. Or I'm in high school and maybe I didn't do so well on my exit exam. And so relating it to where they are developmentally, and maybe even sharing your own experiences with that particular thing, I think can be really helpful and empowering for our kids. So really keeping that in mind. And I think also, for whatever reason, physical illness, if I have a broken arm, everybody knows I have a broken arm, right? So I can really relate to that because I can see your broken arm, and that broken arm might make you sad because now you can't play on the baseball team, or now you can't write or draw because you're right-handed. And I think maybe bringing in some things like that make sense to them, But whenever we're sad inside, people can't always tell because there's not a cast for like inside that people can see. And so again, just having those really delicate conversations in a way that makes sense to them.
And Dr. Sosa, something else that we talked about before this even started, some parents are so fearful of even talking to their kids that it's much easier sometimes to just take an ostrich approach and like just maybe if I pretend it's not there, it doesn't mean anything. I've heard from other Facebook Lives we've done, Dr. Sosa, where parents are like, but if I say it, am I then causing them to think it even more?
Yeah, I'd definitely love to touch on that. If I can go back to what Amy was talking about, if you are noticing these changes, especially with an older teen, you can say, hey, I've noticed some things that are a little bit different. You want to talk about it? And be really open when you start that conversation. It's really important to know that their stresses, their anxiety, their sadness is just as real as everything we experience. We just have different stressors. We worry about my paycheck. I worry about the rent. They're really defined by their friend group, by their academics, by their athletics, by their peers. And so when they're having struggles in those areas, it is really real. It doesn't just feel real, it is real. And so acknowledging that their feelings are real is really important, not discount them. Oh, it's not that big of a deal. Oh, it can't be that bad. Oh, when I was younger. Those are things that you want to avoid doing when you're opening up that conversation with your teen. And the other thing to consider is, where are the places that you have better conversations? So some families have great conversations around the dinner table. Others find that when they're out on a walk or they're sitting in the park. So find those places where you have better conversations and start those conversations there, where your kids are more likely to open up and talk. And really just listen. And that's so key. I'm sorry, go ahead.
I was just going to say that's interesting you said that, because there was somebody, I can't remember who told me, because we try to do these at least quarterly, just talking about the importance of behavioral health. And someone had said once, one of the best, it might have been one of the members of my marketing communications, I can't remember, but a parent had said sometimes the best conversations are in the car, because your child isn't looking right at you. It's kind of a neutral space where, mom's not like, hey, looking right at your eyes, that it's kind of, you could have your favorite song playing on the radio, you're driving somewhere, and you're either next to each other if the child is old enough, or the child's in the back seat, that it's kind of a less confrontational way. And I found sometimes picking up my kids from school in the afternoon has been the greatest potential opportunities to have those conversations with kids. And so I know you touched on this a little bit, but what are some phrases or words you should avoid? I already heard, don't diminish their feelings. Their feelings are just that, and they're justifiable. It might not be how you felt, but you should never say, well, when I was a kid, that was no big deal. So what are some other things, either Amy or Dr. Sosa, that you want to tell parents to avoid when you are having these types of conversations?
I think that's a great example. Also, not being judgmental of kind of what they're saying. Don't be so uptight about it, or, don't worry about it. Things like that it minimizes them and it shuts them down. And what you want is you want them to open up. So you want to ask them open-ended questions where, how are you feeling? Or tell me a little bit more about that. Gosh, that had to be really frustrating. Was that kind of scary for you? And that's what keeps those conversations going. But it's also, again, going back to what Dr. Sosa said, it's also telling your child that you're listening. And when you're listening, and the whole car therapy thing, I have talked about that forever. And you can kind of address all 5 senses whenever you're doing that. You go through the drive-through, you get a shake, and and like you said, it's not as confrontational. It's intimate, but yet it's not. And so I think using some of those terms, well, maybe you should do this instead of that, or, well, what did you do, or what was your part in that? It's going to shut them down. So think about what would I want said to me if I'm sharing something, because these things work with adults as well. Everything we say today works with our spouses, works with our friends, works with our colleagues. Most time we just want somebody to listen, and listening looks like, and that's probably the most important thing I can say, because when I talk to parents a lot, they're like, well, I told them and I did this, but it's like, but did you listen? I hear a lot of what you're saying, but are you really listening? And that looks like eye contact. That looks like leaning in. That means our phones might even be in another room. The TV is off, to really be there and present, and doing an activity that feels good together too. While you're doing that can also help. Maybe you're playing a board game. Maybe you're walking the dog, something that feels good and helps them feel safe and maybe a little regulated so that they are willing to open up to you, because they're not going to do it when they're dysregulated. And you're not going to be listening if you're dysregulated. You're going to be in a heightened state. So again, monitoring your own state that you're in, as well as your child when you're trying to have these conversations.
You're talking about social media, and that was one of the things. I'm sorry, Dr. Sosa, did you have something to add?
I was just going to add that your teens, they know when you're engaged and when it's lip service. They know, and they will shut down if they don't sense that you're really truly there and listening and engaged. So
you're absolutely right. They know. They can call out mom quickly if they know mom's thinking about what she's going to cook for dinner, or she's worried about something else. You did mention briefly, Amy, social media, and Dr. Sosa, that's something that we also want to touch on here. So the social media was, as we say, during a Facebook Live, but it has been a game changer. It has had many wonderful things, helping people feel connected, especially during the pandemic. But there's also a dark side to it too. And so, Dr. Sosa, one of the questions people have is, okay, social media, we know we're never going to have our kids off it forever, but when is a good time to start having those discussions about when a child should have social media, and how you determine when that point is? Well,
yeah, there are laws governing when kids can have a social media account. That really starts at age 13. But just like anything else that we talk with our kids about, it's never too early to start talking with them at a level that is age appropriate, that is developmentally appropriate. And I think the big thing with social media now is that everybody looks like they have a fabulous life. Everybody looks like they are on vacation, that they have luxuries, that they really just have the best life. And there are people who spend their entire days dedicating what they do to making their picture look that good. And so it's really important to talk with kids about, this is actually not real. A lot of this is not real, and people don't always share the negative moments, the times when they're feeling down. They really just want to share their best side and get the most likes. And so really talking with kids, even early on, that a lot of that is filtered and photoshopped or staged to look some way or another, is really important to let them know that's just not reality.
Amy, back in my day, you're looking at Victoria's Secret swimsuit model catalogs, and you're looking at whatever 80s, 90s movie is on, and you would see those perfect specimens of humanity in society's eyes at that time, or that producer's eyes at the time. But it's a lot different when it's right in front of your face. So what are some practical things that you could, because Dr. Sosa is right, you need to tell your kids, this is not real. This is a highly curated version of somebody's life. But how do you put that in terms that a preteen who's surrounded by this at school all the time can really understand and really, really take to heart that this is not real?
So like you mentioned earlier, all of these filters and things like that just kind of exasperate. And Snapchats, I have Snapchat. I don't use Snapchat, but like the whole point of that, I believe, is filters that are fun. But like you said, there's also filters that don't make us look like who we really are. And I was talking to my teenager about this the other day, and I asked her if I could talk about it today, and she said, "Yeah, Mom, you can talk about it," because she could probably do this presentation as well. But she was talking about how she put a photo on Snapchat or Instagram or something, And we were driving and she's like, I didn't get as many views. I don't understand why I'm not getting a lot of views or likes, or I'm getting a lot of likes, I'm not getting a lot of views. And I said, well, why is that important to you? And she said, well, you know, I have a lot of friends and I want them to like see this picture. I really like this picture. I said, well, is what they think about the picture what's important to you, or is it how you felt about it when you put the picture on there? And she paused for a second and she's like, well, I am, you know, I do like the picture, and that's why I wanted to share. Their feedback is not as important to me, but it was. I mean, you could tell that's why you put it on there. You want the likes, you want the views, and all of that. And so I think just helping kids develop that sense of self. And that's through when we praise them, we don't praise them, oh, you look so beautiful today, or you really, you aced that test, you're so smart. We want to use that growth mindset language that talks about, like, my daughter has a better skincare routine than I do. And so really talk about, like, instead of saying, gosh, you're so beautiful today, I really like how you take the time, you're so disciplined in how you care for your skin, or you studied really hard on that test, you deserved that grade. So I think if we use more language around like growth mindset language, and there's a lot of research on that, I think it can help. It doesn't answer all of the questions, but I think it can help kind of start that conversation with especially our teenagers. I don't know if I answered the question on that, but I think that's really important.
That's interesting what you said, though, about it's shifting the language ever so slightly can make a huge difference to your child, that you're not complimenting them necessarily on, oh, you look pretty or you look handsome, but hey, you took the time to do this, or you worked hard to do that. You know, it's just such a different, you know, when it's just such a different mindset. But, you know, to your point, that can make a huge difference. Something also that Dr. Sosa, I'd love for you to talk about is, someone asked, how does my reaction or my own approach to mental health affect my own kids?
Okay, so if we're talking about essentially going off what Amy started talking about with growth mindset, if we're talking about our reactions to our kids, that definitely can have a very positive or a negative impact. For example, if your child really studied hard for that test and they're upset that they didn't get the A or the grade that they wanted, and if you can either add into that and say, you didn't get that A, you're not going to get the 4.0 or whatever it is. Or you can say, I'm really proud of how hard you worked. So your reaction can definitely feed into how your child does. But beyond that, your own well-being and your own self-care, kids feel that. And there were a number of studies that came out at the beginning of COVID that showed how significantly parental mental health was affecting kids' mental health at the beginning of COVID, because there were a lot of stresses about getting sick, about job stability, you know, housing insecurity, food insecurity. And really, kids will just internalize that. And they carry a lot of our stresses with them. And so if we're worried about money and putting food on the table, they may choose not to eat because they don't want to put added stress on us as parents to make sure we're bringing that food into the house. And so it has a tremendous impact, our own well-being and mental health. And I'll let Amy can probably add on to that.
Yeah, because Amy, everybody, especially, I mean, because we're all moms here, so this is my frame of reference. But you know, you always want to project the whole super mom, I got this. But if mom's not taking care of herself, and dad knows this too, then that does no good for the entire family unit. So how do you, as a parent, make sure that you're taking care of yourself, so that, you know, you got to put your oxygen mask on first so you can help others. So how do you help parents remember and practice that?
I think so self-awareness is so important. Just recognizing yourself when you're not regulated, and modeling that. You know, mommy's feeling a little overwhelmed right now. I am gonna go take a bath, or I'm gonna go work out in the yard. Give me about 15 minutes, and I'll be back, and I can answer your question, or whatever that means. And again, depending on their age or whatever. But I think about in the most simplest way, even if you don't know what to say, even if you're so overwhelmed that you're like, I'm going to crack the minute somebody asks me a question, just a smile when your kid walks through the door. What do you look like? What do they see? Are you smiling at them when you wake them up in the morning, when you're kissing them goodnight? Even if you don't have the words, even if you're overwhelmed, just greeting them with a smile, making them feel like you still care about them, even if you don't have the words because you're not in a good place. A hug, a long hug, and even something that helps when I'm working with kids who are really, really dysregulated, that totally just stops their thinking. I don't know all the science behind it. Dr. Sosa can maybe comment, but it's such a little thing. I will ask kids, do you need a hug? Yeah, I'd like a hug. Okay. Do you want a regular hug? Do you want a squeeze hug? Or do you want a spin squeeze hug? And then you see them calm down. And of course, everybody wants the squeeze spin hug. So you do the squeeze spin hug. It makes me smile because it's fun. They're smiling. We're co-regulating now. So even if I'm stressed and they were stressed, without any real words, we're able to kind of co-regulate and come to a mutual place of like calmness, where then maybe I can talk to them about what's going on. But definitely through COVID, I've seen layers and layers of stress for parents. And we talk about teacher burnout. We see parent burnout. They've been isolated in their homes for a year, and just again, somebody losing their job or the death of a relative or a partner, and just these layers of things that are going on for families. So if nothing else, if you are just not in a good place and you're struggling, smile, give them a hug. And sometimes that's all you can do. And then make sure you cut yourself some slack, because I don't know anybody in this world that is perfect parent. And so I could go on and on about that. Sorry.
Yeah, that's important too, Dr. Sosa. Here's a parent now who realizes that maybe they have their own stressors and their challenges. They're starting to recognize it in their kids. What do? Sometimes I'm Filipino, and the Asian culture back in the day, you don't talk to anyone outside of the family. Therapy. What is therapy? What is, that was a big cultural shift that didn't happen until fairly recently. That people in my culture went to therapy. So when you have those types of barriers on top of everything else, how does a parent even begin to ask for help? My pediatrician, by the way, became a very good resource when I encountered challenges for my own kids. But how do you even start that for somebody who maybe doesn't feel comfortable talking outside the family about this?
Yeah, that's definitely challenging. And Filipino culture is not the only one where there is a stigma around mental health. In fact, there's a stigma in general around mental health. It's much stronger in other cultures. But just taking the first steps, just beginning to talk about it, knowing that it is normal. If I have a cold, if I get sick and I'm physically ill, I can't think straight. I can't concentrate. That's because our minds are linked to our bodies. And same when, excuse me, when we're not feeling well from an emotional standpoint, it affects our bodies. So that's why kids will come in with headaches or stomach aches sometimes as their physical complaints of actually feeling anxious or depressed. So just acknowledging that it is normal to feel anxious, to feel depressed. It happens, one in 5 kids, so 20% of our kids by adolescents have a diagnosable mental health condition. I don't have the stats on adults, but taking those first steps to really just acknowledge that it's okay, and know that if you don't get help for yourself, you're not going to be able to help your child. Mm-hmm. I think that those are probably the first steps. And there are numbers. If you can't talk to your family, there are certainly numbers that you can call to get anonymous help, to get help locally, to get help nationally. And so reach out.
Okay, we're continuing to take questions on Instagram and on Facebook. I'm going to bring in one of the Valley Children's interns, Jonah Vigilia, has been keeping an eye on things behind the scenes. Hey, Jonah, how are you?
I'm doing great. It's great to be here.
Yeah, thanks for joining us. I do want to give Jonah and our other intern, Luca, credit for helping us with all of our mental health awareness activities this month. Jonah, I know that you've been keeping track of some of the questions coming in. So you had a couple you wanted to ask Dr. Sosa and Amy Hardcastle too.
Yeah, I have a great question. So we've talked a lot about opening that conversation, but I want to pivot a little bit with this question, talking about good daily routines to help maintain that open communication between the parent and the child. And then also maybe some ways to maintain the positive mindsets for positive mental health.
Okay, so you've talked about it. Now, how do you keep that dialogue open? Great question. Thanks, Jonah.
I've heard some great examples of families at the dinner table talking about what was something really good that happened today, or what was something you struggled with, or they call it a rose or a thorn. What was the rose of your day or the thorn of your day? Asking them how they feel. How are you feeling today? I've noticed you got a little extra pep in your step. Like, tell me sounds like something good happened today. Sometimes letting them guide the conversations, again, depending on the developmental level of the children. But with my own kids, my own personal experiences, when I'm picking them up, like that's the first thing, like, tell me about your day. What's something funny that happened today? So it doesn't always have to be how you're feeling, or like with your little ones, maybe it's some type of ritual where you're doing a high five or a fist bump, like your morning fist bump. I have a ritual that I say to my kids every night when I put them in bed, regardless of how old they are, even when they turn 40. So, I just have these rituals. And I think maybe developing rituals, and that's something you can do with your child. You can have a conversation with them, so they're a part of it. You're doing it with them instead of to them or for them. They can have meaning for them.
Yeah, Jonah, I think that question actually kind of answers itself. It is like the key. What are some routines you can develop? And we know that kids, not just kids, actually, all of us thrive on routine. We thrive on knowing what to expect. What brings us anxiety, angst, is what's going to happen. I'm not sure how it's going to go. And so the more routine we can have in our lives with our kids, the better it will be, not just for them, but for us. And one thing that's also been shown in the literature to help with depression and anxiety is physical activity. So add that into your routine. If you can be, if the weather and the air quality is allowable, get out and do some walking together. That gives you that side-by-side time to have that conversation. And if it's got to be something you do indoors, you can do that as well. But routine, I think, is really key. And on top of that, just eating healthy. When we fill our bodies with junk food, with processed foods, that can also make us feel not as good. So.
Mm-hmm. Nice. Any other questions that came in, Jonah?
Yes, I have one more talking about mindfulness. And that word gets thrown a lot around, and we just want to hear a little bit more about what mindfulness is and why it's so important to mental health. And how can I practice mindfulness with kids?
Well, Amy, you can jump in too if you want. Mindfulness is really just a way of being present in the moment. Whatever it is you're doing, it's a way of slowing down. It's a way of noticing things around you, and it's a way of recentering. So if you're feeling anxious, if you're feeling nervous about something, if you're feeling sad, just stop. And you can practice mindfulness for 30 seconds or a minute. It really doesn't take a lot of time out of your day. It can be a mindful bite. So taking a piece of food, looking at it, what are the details? What colors are it? What does it smell like? What does it taste like? What's the texture? So being present in that moment will help you really slow down and just slow your thoughts down. It can be on a walk outside. Notice 5 things that you haven't seen before. It can be breathing, listening to your breathing and being mindful of how your body feels in that moment. But it really helps kids recenter more than anything. And there are a lot of things we could do. Actually, I think we have a couple of activities on the 360Me website as well that parents can do with their kids. And Amy, I'll let you add in.
Yeah, no, I think it's great that you brought up that link. There are a lot of strategies, breathing techniques, body scans, grounding exercises, again, that just help us be present in the moment. Sometimes when we see depression or anxiety, You know, they're very focused on what happened yesterday, or they're very worried about what's going to happen tomorrow. But just being present today and focusing on today, because that's what you have control over, is just really important. And then some of those exercises that are on the link can really help us to do that, can help us, as you mentioned, recenter, reset, and kind of regulate. And again, all of these things are for our children, but also for ourselves.
And that's something that probably a lot of us struggle with, grounding ourselves in the moment. I mean, Jonah, no, you're not a mom, but you're a full-time student. You've got a job, you've got this internship, you have all these things. Why is it important for also adults like Jonah and all of us here to take that moment to just stop? Because in this world where it's go, 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 it's sometimes you almost feel guilty stopping, which you shouldn't. But
yeah, one of my favorite exercises is the 4-7-8 breathing, which I believe is on that link as well. But I actually learned about that through my primary doctor and how it decreases your blood pressure. So when we talk about adults and all the things that we have to balance, these things also help us with our health, our emotional health, and our physical health. And so it's a preventative. If we're doing it every day, then when we have these layers of stressors that are occurring, we're more likely to handle them a little bit better. And we're modeling it with our kids and going back to activities we can do with our kids. There's all kinds of videos, there's apps. If this is something, going back to rituals and routines, if this is something you do as a family, then it's saying like, this is okay to do this. And again, you're doing it together, and then you can have a conversation about it. How did you feel about before we started that? Well, gosh, Johnny, you know, really upset me on the playground today, but now that we did this together, you know, my heart's not racing as much. I feel calmer. And then just having them recognize how it feels emotionally and also with their body can be really powerful. But it's something you can do as a family.
all right, well, Jonah, when you're in the hospital tomorrow, we're going to do a mindfulness exercise. So we'll make sure to get that done. Thank you for bringing those questions. If there are any more, hop back on, please.
All right, thank you.
But good to see you. Thanks, Jonah. We did touch on this earlier, but probably bears repeating again here, because we did get a question coming in. How does, and not just social media, but peer pressure now too, which was happening even outside of social media. So how does peer pressure and this sense of perfection or the feel of needing to be an overachiever affect my child's mental health? How can we instill a good work ethic in our kids without making them feel that they need to be perfect? So how do you curb those tiger mom tendencies, but also set your children up for success?
I think that goes back really to what Amy was talking about in terms of a growth mindset, not focusing on winning the prize or getting the perfect grade, but really on who they are as individuals and the positive qualities, how hard they worked, how much they helped their sister or their brother, how much you appreciate them. I think those are just really important. If all we do is focus on the end goal, that's not a growth mindset. So we really wanted to move to that.
Okay, Amy, any other words of advice in that realm?
Yeah, to literally build on that, it's having them, you know, everything's about competition and sports and grades and what colleges you're going to get in and pressure. And so as a parent, ensuring that we're not comparing our child to one of our other children. I've seen that in the hospital, like we just, not even intentionally, we have these conversations, but explaining to our students that they're competing with themselves. You want to do better than you did yesterday. It doesn't matter what Johnny's doing. Like, don't worry about Johnny. Don't worry about how he finishes. Like, if you want to get here, what can you do to get there? So really framing it in a way where they're competing with themselves and not other people. I've seen that really help. Again, just kind of reframe for them. But also, it's okay to not be involved in 20 different things. And sometimes we have to make that hard call for our kids to say, you can't do 5 things this semester. It's too much for you. And I've noticed that. And how have you noticed it? And so making those tough calls with them and then having a conversation about how does it feel like to have your Mondays done? Or I know school systems, I believe there's a law in place where now students can actually take mental health days as an excused absence. And even honoring that, I think employers, I think, are honoring it, and now they're honoring it with our school systems. We've seen our athletes take a mental health day and not compete, and even bring it, like Simone Biles, and I think there was a tennis player,
Naomi Osaka. Yep.
Yeah. So again, relating it to people who are in the news and in the media and saying that this is normal. We get overwhelmed and it's okay to withdraw and take a break and not do everything perfectly.
Yeah, it's interesting you say that, because our medical director of orthopedic surgery, Dr. Kerry Loveland, he wrote a blog post on our website around the time Naomi Osaka had pulled out of whatever tennis competition she was in. And he supported that and applauded it, and wanted to remind parents that you know, when your kid plays softball or baseball, there are pitch counts in place to protect the arm. And so when it comes to other things that could be stressing your child, that making sure that their headspace is clear and healthy is just as important as making sure they're physically conditioned. And so we'll have to share that link, because Dr. Loveland did that for us, and it was really eye-opening, because as you both know, these athletes, especially on social media, people could not understand why in the world a multi-million-dollar, you know, athlete here would back out because she said that she needed a mental health break. And both of you probably were like, I get it. You know, like you see it. One question that just came in is from a parent of a 2.5-year-old who asks, when can parents actually begin starting talking about feelings with their kids? How young can you get? I know you mentioned Pixar movies being a great opening avenue there, Amy, but speak more to maybe how young is there a too young, or is it just whatever?
I think kids have feelings at a very young age, and anytime you can put a label to that feeling is just going to help them. You know, what you see might be somebody like banging on the floor, upset, but if you can add words and language for them and help them talk about their body and what's going on with their body, I don't think, if there's an early enough age, you know, and just continuing those conversations, because then you're making some of these things very normal for them. And then they have the language to talk about how they really feel. What I see with some younger kids who come into the ED who have maybe said they want to kill themselves, when I talk with them about what's really going on, they're really sad. They didn't have the intention. They don't want to kill themselves. They said that because they didn't know what else to say. So when you help them put a word to how they're feeling, it can really help. And going back to the developmental age of a 2.5-year-old, like using just really simple words, using dolls, having them express how they're feeling with dolls, or watching a show or getting a book out that kind of covers that. Kids can be really brilliant in communicating. It's just not always the way that we expect them to communicate. It's not always with words.
Dr. Sosa, the providers have been seeing children younger and younger coming in, like you said, and that we have talked about before, especially with the work you're doing with our pediatric psychologists, with screenings, with behavioral health services. I mean, you have been seeing some young kids coming in showing signs of that they might need some help too, right?
Oh, absolutely. Yep. We've been seeing it younger and younger, down to early school age now. And backing up a little bit to what Amy was mentioning in terms of when giving kids words to talk about their feelings. Sometimes people think that younger kids don't really experience, you know, may not have mental health. And it's not so much mental health, but if you imagine you have a 6 or 9-month-old that you hand over to a friend, maybe who that child is not familiar with, what do? They cry and they reach back over for you. And we call that separation anxiety, because they're feeling a rapid heartbeat. They're scared because I'm not with this person who normally takes care of me. And the way that we remedy that is we make sure that they have a nice, soft, protective place to land, right? So the person that takes them talks to them, comforts them, and usually that ends in a few minutes. Same thing when you drop them off at kindergarten for the first day. And that need for a protective place or for sort of positive factors to support kids in their lives does not end In fact, even for us, if we have a stressful day, we want a nice soft place to land. We want some positive words. We want support. We want arms or a hug. And so even before they can put words on it, making sure we are giving them those protective factors to really mitigate the stress and the anxiety that they're feeling. I probably went way off topic with that.
No, it's all related. It is all related. But that does lead to this other question. So you were talking about having kind of a soft, safe place to land. Parents and caregivers of any type, they come in all shapes and sizes, can do their best to create a peaceful, safe environment at home. But then when you start looking out, not just in social media, but just in the news, pandemic headline after pandemic headline, Ukraine, supply chain issues, rising gas prices, rising food prices, employee, just job market is terrible, whatever it might be, right? So when the media around your little safe place is surrounded by these, by this negativity, I mean, we've had school shootings, we've had protests against racial injustice. How do you, because the kids are going to see it. So how do you begin to talk to them? I don't know if Amy, you want to start this one, but when the headlines are super, super scary, but they are a part of reality, how do you talk about this with your child and help them cope with it?
Yeah, you definitely don't avoid it because if you avoid it, they're going to get that information from someone else and it may not be accurate. Mm-hmm. So I think having those open, honest conversations is really important, using language that they can understand at their developmental level. And then also sharing with them how it makes you feel. Like, yeah, this is really scary. And I am worried about the people who live in this country and this particular country, or what happened at that school, or what happened to that person. And it really makes me sad. And even talk about, give them help them empower themselves. Well, gosh, what can we do? Like, we can't do anything about that, but like, what can we do in our family, at our school, in our community to make people feel better so that this isn't happening to them? Like, how can we be a part of the solution within our scope of control? And that empowers them a little bit. But I think keeping it simple, having honest conversations, and then again, sharing how we feel about it can be really powerful.
Yeah, it's tough right now. Dr. Sosa, I don't know if you have anything to add, but media calls us if they need a quote on COVID or whatever is happening. And it is a constant barrage of these negative headlines. It's real life, so you can't really shut them out, especially if your child is older. But do you have any other advice, Dr. Sosa, for kind of helping kids cope with the world as it is right now?
Well, the world is available 24/7. So trying to limit that exposure, having those conversations, but you don't have to have the TV on in the background 24/7 talking about it, because it does not end. Find a safe space, turn that off, unplug, if you will, and have that time together. But if we let it, it will be there. It will creep in 24/7. So you're right. Boundaries are good. Setting those boundaries and those limits now.
We answered all of the questions. Actually, there was one more. There have been many families, and there have been studies that I can't remember the exact number. I don't know if you remember, Dr. Sosa, the number of people who've lost family members due to COVID, that so many children have lost loved ones. And there was a question that came in late this morning from someone saying, how do you address, death or serious illness if the child is preschool age, so young like that? How do you begin to talk about these very difficult conversations? Because unfortunately, we are still in a pandemic and people are losing loved ones still.
Well, I think similar to what we were talking about really throughout this Facebook Live is looking at the developmental level of the child, and so understanding where they are and what they can understand. So for, you said preschool age, so in the 0 to 3 range, more or less, they don't understand tomorrow. They don't necessarily understand yesterday. They sort of live in the present, and they may be pre-verbal or or not very verbal, not verbal enough to really express how they're feeling. So they tend to react more to behaviors and react and act out through behaviors. And so some of the ways that you can help is just to have very simple language and understand that they don't understand death. Keep a routine, because as we talked about before, routine is really critical to the well-being of all of us. If you're a little bit older, the 3 to 5 year age, they also don't understand finality of death, and they have much more magical thinking. So that's the monsters under the bed or in the closet sort of age. And there are a lot of fears. And so if they are acting out, don't punish that. That's them reacting to what is going on. Talk in very simple terms. And so really understanding the developmental ages of the child as you're talking about death or serious illness is really important. And I'll let Amy add there.
I think you said it all. I think another way is to even memorialize in wherever they're at in that developmental level, the person who has passed away, whether it's a drawing or clay or whatever that might be. Play therapy can be really powerful. The Footsteps program has a beautiful art therapy program for all ages. And again, maybe they may not have the words, but it's a way for them to kind of release some of those feelings in a safe way.
No, thank you. So we've gotten to all the questions now. Want to thank you both for your time. And before we end, I just want to say, for me as a mom, as an employee of Valley Children's, the greatest thing about these discussions is knowing I'm not alone, and my friends talking about it, and all of you talking about it, knowing I can talk to my pediatrician. So I personally, as well as professionally, greatly appreciate both of you taking time to discuss this topic that for many people is still very, very difficult to talk about. But before we leave, I don't know if you had any parting words. Why don't we start with you, Amy?
Again, don't be afraid to reach out for help. We all have gotten to where we are today because we've reached out and gotten help from others. And there's so many resources within the school districts. Most school districts have psychologists, social workers, or counselors. The link that we mentioned earlier, 360, has a lot of great resources. Going back to social media, even on social media, there's a lot of great resources out there. But don't be afraid to reach out for help. A lot of times when people are like, no, therapy's not for me, I don't like it, but we've just had this long conversation about what's going on. I'm like, it's not any different than the conversation that we just had. And they're like, oh, okay. So I don't know what they were thinking, but again, listening and parting words. Yeah, thank you so much for having me here.
No, thank you. And Dr. Sosa, you're like a regular on this show, but we always love this segment, but we always love having you. Anything else you want to add before we say goodbye to our friends on social media?
I would just sort of reiterate how important it is to have a routine, to talk with your teens, to talk with your kids, to talk openly and really just listen and take in what they say. You had mentioned something earlier, Zara, that a parent said, I told them this, and it's really not about telling them. It's saying, what do you need? How can I support you? How can I help you? There's not one stop shop. It's not a prescription. The same thing doesn't fit everybody. And so asking your kids, what can I do? How can I help? And really being that open conduit for them to bounce off of. I would certainly rather have them bounce those things off of me than social media, strangers or friends. I want to be that place for them. So my parting words really just listen with open ears and open arms.
Thank you for that. And again, to plug our section of the website, 360Me. So if you go to valleychildrens.org and you go to the 360Me section, you'll find all kinds of activities, including tips for mindfulness. On social media, we have our mental health minutes. They're exercises we share every Monday. Last week's was like, put your phone down for a second and just like look around you and be aware. So that goes along the mindfulness. And then also wanted to give just a very quick update because we get asked about this a lot. There is a new hospital that's going up right next door. It is construction is set to be complete around November, December, with the first patients coming in, Dr. Sosa, early next spring, right? I believe it's early next year. River Vista Behavioral Health is going to provide inpatient and outpatient mental health services, behavioral health services for children and adults. This is something that's been very near and dear to Valley Children's leadership to partner with Universal Health Services on this. So we're so excited to be having our partners right here. So just know that even more help is out there. It's coming, and take care of each other. And remember, you are not alone. We've all been there too, and we feel it too. So thank you for those of you watching at home. And if you have any other questions, feel free to again leave them in the comments. We'll get those answers. Dr. Sosa, Amy Hardcastle, thank you very much, both of you. Have a good day, everyone.